We have 2,942 cases of coronavirus in the state. That's 134 more than yesterday. The Chief Health Officer or one of his deputies will be providing further information via their usual statement later in the day, but I can confirm that 11 of those 134 cases are connected to contained outbreaks, and 123 of those are under investigation by our public health team. 75 cases now in the 9 towers that are locked down. In terms of some of those being a reconciliation where they would have been known positives in our numbers but have only now been able to be attributed to residency in the towers, but the total number is 75. And the Chief Health Officer will be able to speak to that or at least provide further information at a later point. We have 860 active cases, 41 Victorians are in hospital and 7 of those are receiving intensive care. The story of the day though, from a public health and activity point of view, is the fact that we did 29,424 tests yesterday, so substantially higher than the records we had set earlier in the week. That takes us to a total of 1,008,677 tests since January 1. So as we predicted, we've broken through that 1 million test barrier, given the almost 30,000 tests that were conducted yesterday. Can I again thank every single Victorian who's come forward for a test, and the many thousands of people who are working to take those tests and to process them. It makes the point that everyone, a mighty team, a massive team of people are doing everything they possibly can. We are all working as hard as we can, doing the very best that we can. And we know that we're asking a lot of Victorians, and we know, of course, that we didn't want to be in the position that we are in. But that's the reality that we confront. This is the challenge that we have to meet, and I think that if we all work together over these next 6 weeks, as painful and frustrating and difficult as that will be, we will be able to get to the other side of this stay-at-home period. We'll be able to then recommence our opening up in a cautious way. We'll be able to repair the damage to the economy that this virus is doing, and along the way we'll be able to support those who need that support, whether it be businesses, families, individuals, or indeed communities. This is, as I said, not the situation that anybody wanted to be in, but it is the reality that we must confront. To do otherwise is to pretend that this isn't real, to pretend that we have other options. The best public health advice is to take these steps. That's very well considered advice. The decision to take these steps is not an easy one. It's not taken lightly, but it is the most appropriate response to, again, take control of the virus, drive down case numbers, and get to the point where we can recommence that opening up in 6 weeks' time. That's our plan, that's our hope. We'll all be working incredibly hard, day and night, to deliver that outcome. Of course, every Victorian has to join us in that effort. I'm confident they will. We have got a unique challenge in that we have significant community transmission, but at the same time we have vast areas within regional Victoria where there is no community transmission, other parts of regional Victoria where there are small numbers of cases, and we have to safeguard the status of regional Victoria. And as I said yesterday, we are doing the hard work to look at options to accelerate opening up in regional Victoria for regional Victorians. That comes with significant economic benefit for them and therefore the whole state. That is only possible if we can continue to safeguard the very low COVID or COVID-free status of large parts of regional and country Victoria. To achieve that outcome, then we do have to have a hard border between those 31 metropolitan LGAs and Mitchell Shire and regional Victoria. Again, no one is pleased to be in that predicament, to be having to confront those circumstances, but there is enormous benefit across regional Victoria if we can get that job done. Victoria Police, with support from the ADF, some 264 ADF personnel will be providing logistical support, practical support to Victoria Police. Obviously, ADF don't have the same powers as our members of Victoria Police, but they'll be working together as one team, just as they have all the way through, whether it be in the State Control Centre or working side by side with our nurses and public health officials at mass testing sites, or in the many other roles that ADF and, can I say, Commonwealth public servants who may not wear a uniform but have been very, very important to us all the way through, and certainly in recent times. I know you'll have lots of questions, so I might leave it there and ask Lisa to speak to the top line issues in relation to enforcement of these rules and that internal border issue, if you like, checkpoints, roadblocks, not every vehicle being tested, not every passenger being quizzed, but there will be a rigorous process, randomised, but constant. It'll be there throughout every day and every night to make sure that only those who have a lawful reason and absolutely need to be using that lawful reason to travel to regional Victoria are doing that. Again, I know there will be some inconvenience there. Of course there will be, just as there is with the New South Wales border closure. But these are the steps that must be taken in order to get us to a point where those numbers firstly stabilise, then we drive them down to very low and acceptable, manageable levels over this next 6-week period.